Please welcome to the TEDxSF stage, Suellen Miller.
Good morning, everyone. Thank you so much. I'm so glad to see all of you here. What I'm going to talk about today starts in 1975 when I was working as a I was working as a certified nurse midwife. The goal of our home birth practice at that time was empowering women and families for an ecstatic birth as the start of their family life. It wasn't until 1987, when I started doing international work, that I found out that the woman becoming pregnant was not always such a joyous occasion. Working in Zambia, I found out that when a woman told her friends that she was pregnant, they told her, "You have one foot in the grave." And when she delivered, she was not greeted with the words, "Congratulations," but in the local language, she's told by her friends, "You've survived." What is it that accounts for an inequity in which women in Denmark and Norway, Italy, Greece, and Spain don't even think ever about dying in childbirth? The risk of dying in childbirth in those countries is 1 in 20,000. In other countries, Democratic Republic of Congo, Chad, Afghanistan, Ethiopia, the risk of dying in childbirth is 1 in 15. What accounts for a more than 1,000-time difference in a risk? I'm not going to discuss the United States today because, unfortunately, the United States is 39th in the entire world in maternal mortality rates. And these women died in the United States due to a lack of access of quality health care. Why then does there exist a huge discrepancy in maternal mortality rates around the world? Simply put, the reason is that women are discriminated to death. Maternal mortality is a gross violation of human rights. And when any country fails to deliver health care that only one gender, like maternal health care for women, that only one gender uses, that is a violation of the woman's human rights. So these gross inequities, gender inequities, social inequities, economic inequities, underlie what we call the 4 delays. And when we talk about the 4 delays in maternal health care, what we're talking about, physical reasons for death, too much bleeding, which is the subject that I study, affect everyone everywhere, but it's only in certain places that delays that are caused by these social gender inequities and human rights violations that cause the deaths. So I'm going to tell you a story about a composite woman whose name is Aida. And Aida lives in Africa, sub-Saharan Africa. She never had access to education. She never had access to family planning or to safe abortion. She never had a say in how many children she had, where or when she was going to deliver them. When she went into labor with her 9th child, the traditional birth attendants came to her home. These women were supportive, but what they were unable to do was to provide her with the knowledge, skills, and training that a skilled birth attendant would bring. And Aisha herself did not have power in her own home. So when she started to bleed too much, it took a long time for the complication of too much bleeding to be recognized. Once this delay was overcome and the problem was recognized, there was a second delay. And this delay happens in a lot of places because of unequal power in decision-making. In some places, it's only the man in the household who can determine who gets to spend precious resources on obtaining health care. In fact, if a woman can even leave the home to deliver her baby. So another delay is a delay in the decision-making around seeking health care. Transportation is a huge problem in many parts of the world. Not only are healthcare posts very far from where a person might live, but people don't have access to fuel and they don't have access to vehicles. So again, for Aisha, a lot of time was spent running around while fuel and a transportation method was obtained. And the very first health post that they arrived at, which would have provided some basic care, was not staffed that day. So they had to spend even more time trying to get another vehicle to take them yet once more, this time to this university teaching hospital. And we've been talking about Mission Bay and the university teaching hospitals. This is a university teaching hospital where, if care could be obtained, this is the only place where it could be obtained. Unfortunately, so much time was spent. Aisha bled to death before she could receive the care that she needed. This story is true, and it happens 800 times a day around the world, where women do not have the right to quality health care. When a woman dies in childbirth, it's a tragedy for her, it's a tragedy for her family, and it's a global tragedy. It's been estimated that maternal mortality costs about $7 billion annually in lost productivity. We have a loss of lives, we have a loss of meaning in families, and we have a productivity loss. So I know this has been very grim. It's certainly what I deal with every day, but there is progress and there is change being made, and I want to share with you a vision of what is happening and what can happen. Education for girls is number one. If girls are educated, they delay childbirth until their bodies are ready to have babies, and further, they have fewer children, and they get a voice in how finances are spent so that they can have decision-making power. Communities need to be educated about what are complication signs. How do you recognize when too much bleeding is happening so that you can more rapidly get to care? Another thing that's happening that's fascinating at a community level is something that I call the tradition iconoclasts. And these are peers who realize that some traditional practices are very harmful for girls and women. And so rather than, for example, allowing a young girl to be married, peers go and present culturally appropriate arguments for why marrying off a young girl may be harmful to her health. These have been very effective. As I said before, recognizing too much bleeding is an important thing. So we have been working with using local materials. In almost every place where a woman delivers at home, she's using something that is in every household, a certain kind of rag that's used to clean the floor, a sari, a dupatta, a chitenge or wrapper in Africa. Once you know how much blood that usual and customary thing holds, you can alert family members, the woman herself, or traditional birth attendants. If too much blood is lost, this is the sign. When this pad is saturated, you must get help. Transportation is being overcome by really inventive things like this bicycle hammock. And in many places now, bicycle and motorcycle ambulances are getting people closer to hospitals and shortening that delay that I described. Cell phone technology has penetrated into rural Asia and Africa, and it's a wonderful way of bringing diagnostic capability of the highest level down to the hut level. And we have seen so much changing because of these diagnostic capabilities of smartphones and dumb phones. Something as simple as a cell phone taking a photograph can change everything. If a traditional birth attendant takes a photograph of a woman in labor and sends that to a provider at a healthcare system somewhere higher up, that provider can overcome all the delays, inform the healthcare worker that this is a complication that requires assistance. The healthcare provider can convince the family that the woman needs to go to the hospital, can call an ambulance, and even prepare the healthcare facility for the arrival of a sick woman. A simple pill called misoprostol that any woman can be taught to take can decrease postpartum hemorrhage by 40%. And the Life Wrap, a non-pneumatic anti-shock garment, this is what UCSF's Safe Motherhood Program has been working on. This device, which is made out of neoprene and closes with Velcro, when wrapped tightly around the bottom of a woman who's been bleeding, this device can decrease maternal mortality by greater than 50%. So I'm showing you that progress can happen, but it's not happening fast enough. And that's where I want you all to play a part. Progress can happen, these innovations are great, but none of them, or even all of them together, is enough. What is needed is political will for girls' and women's lives to matter and transformative thinking. And that's where I want all of you to think about what you can do to make a difference at the community level where women are learning to read, to make a difference in how healthcare is being delivered. So what am I asking you to do? I'm asking you to really be a transformation agent. I'm asking you to really think about what could you do, and I'll tell you. You can support the entrepreneurs and the inventors that are coming up with these technologies. You can support the governments that are working to make a difference in policy for women and girls' access to care. You can support organizations working for maternal health care, and you can be a transformation agent. I'd say the greatest thing that anyone can do, and that's all of us, that all of us can do, is to advocate for safe motherhood as a human right. Make sure that every woman, no matter where she is born and no matter where she gives birth, that every woman can experience childbirth as a celebration and not as a death sentence. Thank you.